Well, hello everyone. We are just going to give everyone a little bit of time to jump on and then I will get started. All right. Well, happy Wednesday. I just want to welcome everyone. And I want to thank you for joining me for this session on the modern male. My goal today is to take the mystery out of jawline filler and facial sculpting. And then my hope overall is to create a holistic and educational look at the architecture of the male face. I will discuss working with your natural anatomy to achieve natural and structural results that simply make you look like the best version of yourself and also feel like the best versions of yourself. So, just a quick introduction of who I am for those of you that do not know me. My name is Chris Martindale. I am an aesthetic nurse injector. I have some exciting news on Sunday. I graduate as a nurse practitioner from Duke University. I've been working in aesthetics at Fulcrum for 3 years since we opened. And yeah, a little fun fact about me is I'm from Michigan originally, and I've lived in California as well and was in the military. So I just wanted to get started. I think this is a really cool visual that I found and I've incorporated previously during discussions, but taking a look at what the aging male really is, it's crucial to understand and observe not only what we see on the surface, but what is happening beneath the surface structurally. Every face is created based on your genetics, something that we don't have control over. But when I talk about that, what I'm getting at is your bone structure, the fat distribution, everything from the way that your angles on your face look and feel. So this aging process really impacts the face across three main pillars. So the one thing I really want to first talk about is actual bone density. So over time, we start to lose that. The second is our facial pads, which over time sadly start to deflate and descend due to gravity. And again, that loss of that bone structure and skeletal like scaffolding, as I like to call it. And then finally, um, into our 30s and on, we start to lose that collagen elastin that allows that firmness in our face to really hold those shifting tissues in the bone beneath the skin. So as you can kind of see, and then just kind of what I just talked about, aging is a multi-layered process, and the approach to restoring the face must be done the same exact way. So it has to be equally comprehensive. Treating just the surface will ignore the root cause, and that is what we need to really create undetectable results. And it's just addressing each level of anatomy and layer. So the first thing I want to kind of touch on is just I'm going to go over some tools that are in my toolkit as an aesthetic nurse injector. The first thing we're going to talk about is dermal fillers. So that is a hyaluronic acid-based injectable. How I use these is I use them to restore the structural architecture that naturally changes over time, as I just discussed. So, as an injector, to me, filler isn't just about adding volume. It's a truly strategic tool to help rebuild that foundation and create a balanced masculine profile. Whether it's a sharper jawline, a little bit more precise cheekbone, there's ways that we can do this to create contour with like instant and natural looking results without being overfilled. As I kind of talked before, from the surface to down to the bone, the key within fillers is precision. And by this, I mean placing the product in the tissue plane needed to mimic the structure we're aiming to correct or replace. So again, it could be replacing bone, it could be replacing or kind of refreshing those fat pads. And then ultimately with each one of these products, the goal would be to have you looking like that best version of yourself matching your goals, and then making sure you're just not looking filled or overfilled. So one of my favorite things to talk about, I do love filler. I'm not saying I don't, but biosimilars are, in my opinion, as an injector, absolute game changer. Um, Unlike a standard filler, these products trigger a controlled response that leads to your body to replace and produce its own collagen over time. So that can help with that structural support from the inside. It can help with that firmness that we tend to lose over time. One of the things that I like to do, depending on the timeline that you have, so whether if you have an event in a couple months, it's probably not the best to do a biosimilar, but if you are kind of in it for the long game or the long run, I like to start with biostimulatories on this path and then use it as like a strategic pivot to kind of that more natural outcome. So building that foundation first. And when I say building that foundation, it's using a product like Radius or Sculptra, um, to help really restore that collagen foundation that we tend or we lose naturally over time. Then about 4 to 6 months, I typically like to do a reassessment, really waiting for that collagen to start to reproduce. And then from there, that's when I take work with you and have an assessment to determine if we need hyaluronic acid or what the next best thing that we can do to get like achieve the goals. So like this, the way I kind of look at it is it's like going to the gym. You can't overnight build muscle. It takes time. So it's just kind of creating muscle and being smarter over time. So this is one of my favorite things to share. This is a before and after of myself. I got jaw filler, chin filler, cheek filler, and one of the things I really like about this is that it does look so natural. Um, I felt natural. I felt really confident after this, and it was the first time I actually I didn't know what filler was. I didn't know anything, but I was lucky enough to have an injector who walked me through the entire journey and kind of taught me everything I know. But Brittany Krasel, so thank you for that. But as you can kind of see, if you just look from where my cheekbones lied and then just work your way down to my jaw, you can see where my natural bone structure had some deficits in it. My chin was not as pronounced, and my cheeks were kind of with age starting to descend. So just adding a little bit of filler in the precise and correct areas, I just achieved that chiseled jawline that I didn't even know I wanted, but I love it now. So I just wanted to share this because I do think it's really important that I've been on this journey and I'm not just kind of speaking to the products or the what we can do. I've actually had it done to myself and I know what that experience is. So the other thing I kind of want to talk about. So when we talk about if you're a patient as a male and you come into me and you say, well, I just want jawline filler. Like I kind of just talked about, one of the big things I like to do is you always kind of want to start from the cheeks and just like work your way down. And then from looking from different angles to really approach how we do this. But one thing I really love within the aesthetic medicine world is making sure that we're complementing treatments. So yes, you can come in with filler, you can come in and you can get that achieved jawline or the chin that you've always wanted, or maybe the cheeks just looking a little bit better, but then really complementing it with something like neuromodulator. So when I talk about neuromodulator, it's Botox, it's Dysport, Lativo, there are other Daxxify on the market that we can use, but that really helps kind of relax those fine lines and wrinkles. Or as a male, sometimes by time we go to get treatment for neuromodulators, we kind of have them set in. So this can help really just create that well-rested, confident look that we're all looking for. I just touch here on some of the most common areas. Um, the glabella, so your typical 11s when you make that angry face, those can start to set in. It can kind of make us look angrier than we actually are. Men typically have a heavier front brow. The frontalis muscle is the muscle in your forehead, so helping kind of relax that. And then the muscle around your eyes kind of creates what we most commonly probably call as crow's feet. So that just kind of combining this with filler can kind of really help create that sculpted look and rested natural look overall. So this is just a patient of mine that I had that I did neuromodulators on. So as you can kind of see on the far left, the wrinkles around his eyes are softened in the one on the right. The middle picture is the frontalis, as I mentioned. It helped soften and relax those lines. As you can kind of see, one thing we always do within our practice is do a 2 week follow-up. So right above his eyebrows, he's actually pulling a little bit, but I did do a follow-up with that and added two more over that. On the far right, like I said, we can kind of have that angry look as a male. And this just helps soften those lines and that expression in the center. The other thing I want to touch on when I talk from like a holistic, comprehensive standpoint is yes, we can use filler. Yes, we can use biostimulators. Oh. PRP, which is platelet-rich plasma, which actually uses your own blood product, can help from a regenerative treatment standpoint. So we're using your own growth factors. And two of my favorite places to use this is one on the hair and one for the under eyes. I have a lot of patients, and myself included. My under eyes are a big kind of place of concern, and injecting this under eye can be a really beneficial treatment, especially it just brightens the under eye. And then for hair follicles, it really does help reactivate those hair follicles over time. So it's just a natural way to treat yourself using your own blood product, which I think is pretty amazing. One thing I do want to touch on too is at the end, I will be taking questions. So if you are putting them in the chat, I currently can't see them, but I will get to those at the end. Um, as I talk about this, I just wanted to kind of put it together of I talked earlier about how our genetics impact a lot, and then there are things that we can do within the step of medicine to meet your goals as a patient. When I talked about everything earlier, I kind of mapped it into what I call the modern blueprint. So the first one was the anchor and the edge. So that's really the structural foundation of your face. So that is the bone structure, that's the fat pads, that's the collagen elastin, your skin integrity. So whether you're coming to me for jawline filler or chin filler or cheek filler, the combination to really create that anchor and that edge, so the cheeks really anchoring and then the jawline really looking chiseling with like a chin structure. That's kind of what I just deemed that. Second one was, as I mentioned, I really like to combine treatments. I don't like to do a one-stop approach, although you can. The strategic use of neuromodulators, so Botox, Dysport, to smooth the forehead, your 11s, or the areas around the eyes, it does just really give you that refresh, energized look. And it can still look natural and undetectable. And then the very last one is, again, one of my, I think it's kind of changing the world of aesthetics currently, but it's the regenerative approach of using PRP to fix under eyes and adjust the hair. So this is the big one that I kind of really wanted to touch on. And I think that this is something that is probably the one of the most important things beyond safety within the work that I do. But every consultation is where it all begins. It's the journey for you coming in and sharing your goals, your concerns, what you want to see long term. And then really just working with me to utilize the tools in my toolbox to kind of create the best outcome. For me, your aesthetic goals and your natural anatomy is where we build upon. So it's truly analyzing your face, looking at those anchors, looking at those edges of your face. And then ultimately, my job is to take care of you. So I really want to listen to your concerns, your lifestyle, and then meet you where you are. And we all truly are our own brand. And I really just think it's super important from the beginning to align with your injector and what you really want. We do have I have a lot of knowledge. Other injectors I work with have a ton of knowledge, but truly you know what's best for you. And we can kind of guide you with that. I'm really big on the holistic, comprehensive outlook, going as natural as possible, but meeting your goals at the same time. So making sure that the product that we're using or we're selecting matches what your goals are, and not vice versa of me just kind of telling you what you need, and not listening to your goals. And again, I kind of have my own natural promise with myself and to each one of my patients, but it really is just creating that better version of you. We all have those days where we know that whether we don't feel our best, whatever the reason is, if we can change that or we can create a smile on our faces when we're looking in the mirror at ourselves, I think that is a truly powerful thing. So I've been talking a lot, but now it's time to ask questions if you have any. Doesn't look like we have any right now. So the other thing I wanted to offer is we will be here. I am available for consultation, so you can use this QR code if you want to save it to schedule a consultation with me. And then we do have an artful angle filler package. And if you schedule with me prior to May 15th, so you don't have to have the appointment by May 15th, but you will enjoy 10% off of that. But other than that, I also wanted to say that next week we are doing another Master Series class with Carolina. She's doing BBL and Moxie, preventive skin health. BBL and Moxie is actually one of my favorite treatments as well. So, and Carolina is super knowledgeable. So if you have availability, we would love to have you join us. And on that note, I will check one more time to make sure we don't have any questions. So the question was, should men get lip filler? I want my chin and jawline done, but I want my lips too, but I still want to look like a male. I think yes. I think this is a great question. I think lips are a really unique approach too. I think everyone's goals are different with them. You can make lip filler look very natural and truly undetectable. You can approach it where if you come in and you want plump lips, you can do that. But if you just want like kind of a hydrated, defined, structured lip look, I think that's very achievable without creating a feminine look. Hopefully that answers the question. But yeah, I think kind of what you said, I didn't bring up lips, and that's actually, I'm not sure why I missed that one, but yeah, I think it's just looking at the whole face. So if lips are concerned, it's something that can easily be done, and um, it looks very good with jaw and chin as well. Second question we have is, do I need to shave if I have facial hair? Ideally, it does help, especially if you are doing jawline filler, just so that I can really see the structure underneath and just kind of for like sanitary reasons. But that is definitely something we can talk about during consultation of what that looks like and how that looks. And then other than that, well, I really want to thank everyone who joined. I truly appreciate you taking the time to let me walk you through this. And again, like I said, using the QR code to set up a consultation, or you can reach out via social media with any questions as well. But I hope you guys all enjoy the rest of your night and the rest of your week.